Are you concerned about breast cancer? Hi, I'm Dr. Fan, Australia-based general surgeon, here to talk to you about the top 5 symptoms that may point to breast cancer. Number 5, breast lumps. Lumps do not always have to mean cancer, but concerning features include breast asymmetry, lumps that are stuck down to the chest, lumps with hard uneven borders, and your age being greater than 50 years old. Number 4, breast pain. Breast pain is actually not a common symptom in breast cancer, which tends to be painless. Nevertheless, persistent pain, especially if there is also a lump, should be investigated. Number 3, enlarged lymph nodes. Lymph nodes in the armpit feel like little marbles. They can be enlarged for many reasons. But if you have a breast lump and armpit lumps at the same time, you should be concerned. Number 2, skin changes. Changes on the skin, such as redness, ulcers, dimpling, and puckering, are all concerning features for breast cancer, especially if there is a lump underneath. And number 1, bloody nipple discharge. Whilst nipple discharge might be normal, blood in the discharge is always abnormal. If there are any other changes, such as nipple distortion, then the suspicion for breast cancer is even higher. Whilst breast cancer can produce these symptoms, the majority of early breast cancer do not produce any symptoms and are only picked up on breast screening. More on that later. Firstly, let us discuss breast cancer. Breast cancer is the most common cancer for women worldwide and results in the most female death due to cancer. It most commonly occurs in women aged over 50, and the risk increases with age. Whilst it is usually thought of as a disease for women, 1% of breast cancer actually occurs in men. The biggest risk factors for breast cancer are genes, such as the BRCA1 and BRCA2 gene defects. Whilst BRCA gene defects are the most well known, a number of other genetic conditions also increase the risk of breast cancer. These include CDH1, Li-Fraumeni, Cowden, Peutz-Jeghers, and Lynch syndrome. In addition, there are likely genes that are not yet identified, so family history of breast cancers are also important. Prolonged estrogen exposure is an independent risk factor for breast cancer, so factors such as early age of menstruation, late age of menopause, the use of estrogen or hormone replacement therapy can also increase the risks of breast cancer. Other environmental factors such as smoking, alcohol, high-fat diets, and radiation exposure also increase the risks of breast cancer. If you are concerned about breast cancer, there are 3 things that you need to do. Number 1, book in a review with your doctor and have a medical opinion and physical examination. Number 2, get a breast ultrasound, mammogram, or both for both breasts, even if only one side has the symptoms. In general, due to the density of breasts, ultrasound is better for detecting breast cancers in women under the age of 40, while mammograms are better for detecting breast cancers in women aged over 40. Speaking of mammograms, anyone with concerns for breast cancer can go for breast screening with a mammogram starting from the age of 40, even if there are no breast symptoms. And number 3, get a biopsy. Once a lump has been identified on ultrasound or mammogram, a biopsy needs to be done to check for the cells and assess for cancer. The biopsy will also assess for specific receptors such as estrogen, progesterone, and HER2. Knowing the status of these receptors will allow for targeted treatment. In some cases, if there is a strong suspicion for cancer, but nothing can be found, an MRI can be done to assess the breast. However, this is not usually necessary. Once diagnosed, treatment depends on the extent of the cancer. The overall treatment plan will likely involve surgery, radiation therapy, hormone therapy, and chemotherapy, if required. Surgery can involve just removing the lumps, as in a lumpectomy, or the entire breast, as in a mastectomy. Removing just the lump is an option for smaller, less aggressive cancers. If this is the case, radiation therapy to the chest wall will be required after the operation. This is not always the case for mastectomy, and radiation therapy is only needed for more aggressive cancers. There are breast reconstruction options after a mastectomy. This can involve a breast implant or a flap reconstruction. A breast implant is typically made of silicone and can be placed under the skin to match the contour of the remaining breast. A flap reconstruction involves taking muscle, fat, and skin from another area, such as the belly or the back, and use that to fill the empty space left behind by the removal of the breast. You will also likely require the removal of at least one lymph node, a sentinel lymph node biopsy, or all the lymph nodes in your armpit, an axillary lymph node dissection, depending on if there's cancer in the lymph node. Hormone therapy in the form of tamoxifen or aromatase inhibitors is usually offered if the cancer has an estrogen or progesterone receptor. Anti-HER2 receptor therapy, such as Herceptin, is also offered if the cancer is positive for HER2 receptors. Chemotherapy is offered to people with aggressive cancers and can be started before surgery to shrink down the cancer first. Young people and those with aggressive breast cancers or a strong family history of breast cancers should also be offered genetic counseling. Family members should also be tested for gene defects such as the BRCA1 and BRCA2 genes. Well, I hope that you have learned something new. Please comment below if you've ever had these symptoms. Please like, subscribe, and share for more videos. Until next time, stay healthy.